The Director General Health Services, Dr. Charles Olaro, has called upon researchers to focus on reducing maternal death caused by high blood pressure. Dr. Olaro was speaking at the launch of Center for Health and Social Justice by the Ahaki Institute. He pledged government support and collaboration and appealed to Ahaki Institute and partners to further support the government's anti-malaria vaccination campaign.
But working with them, I must say that Moses now we have a new blood bank which is opening in Arua, one is opening in Hoima, one is opening in Soroti. The other day we're breaking ground for Lera, and we really would intend to have one. So now we are seeing that the maternal deaths caused by hemorrhage are reducing. But we are seeing that maternal deaths caused by high blood pressure is what? Is increasing. So we need to be able to see that we need to work with institutions like this so that as part of your research arm, we'll be able to see that how do we address some of these key challenges.
Annie Gathumbi, the board member of Ahaki, cautioned African countries to reduce over-reliance on foreign aid, saying it cannot sustain their health systems.
So, and then this over-reliance on foreign aid is really, right, we are at a waterloo, and I hope our governments, the governments in Africa, have woken up with the withdrawal of aid from Americans that were the backbone of a lot of health systems, strengthening particularly around HIV/AIDS, issues of maternal and child health. And really the hope is that our governments are going to be investing and relooking at their budgetary allocations, because it's a wake-up call for all of us.
Dr. Moses Mulumba, the Vice Chancellor and Director of Ahaki Institute, promised to bridge the gap between government and other partners in policy making.
So we realize that gap because very many actors that we have, people working in the embassies, people working in civil society, people working in government, all those that talk about advocacy, they are learning on the job. They don't have anywhere to go in the country or on the continent. And the courses that are existing are, you have to take a plane to the US. Some of us have been lucky to actually take the planes to the US to go for the short courses, what they call summer courses.
The Minister of Health in Mengo, Kotili Dachkomeko, appealed to the Institute to consider needed brilliant students to fulfill their dream of attaining higher education. The Ambassador of the Netherlands to Uganda, Frederick Quispel, welcomed the vision of Ahaki Institute for supporting sexual health, reproductive health.
To become part of this campaign. And so we can talk about sensitive topics, but we can talk about what women talk about amongst themselves all the time and get these men involved. And also, what I've noticed about the men that are really into this, they all have really strong mothers, they have strong daughters, they have strong partners, and they know how important it is to indeed, as you said, MC, stand behind those. You said beside every strong man, I think behind every strong woman, there's a strong man, and then there's loads of strong women around.
Ahaki is an African research and training institute that uses Afrocentric approaches to generate knowledge and enhance advocacy capacities in the areas of health, human rights, sexual and reproductive health and rights. William Uranga, Beg Television.